Hi, I'm Mark Zampatti from the Corio Sports Treatment Clinic. Today I'm going to show you a taping technique that we use for people with Achilles problems. So if someone's got Achilles tendinopathy or tendinitis, or even people that have come back after having Achilles surgery, if they've ruptured their Achilles, this is a nice supportive technique that we can use. It's also quite good for those kids that get heel pain that's associated with growth plate issues, and it's sometimes called Sever's disease. It's not actually a disease, it's a condition where the growth plate is getting overloaded. We can use rock tape to help us to give some support to the Achilles. It's a pretty simple technique. Basically we take a piece of tape, and if we start with the tape underneath the foot and we come up to around about 15 centimetres above the calf, above the heel, and that's about the length of tape that we need. So if we then cut the tape, maybe a little bit more than that, maybe 20 centimetres above the heel. If we then round off the corners of the tape, and this is to make sure that the tape doesn't lift when we're taping it. Essentially with this one, we peel from the end of the tape and try not to get too many fingerprints on the tape. We start on the bottom of the heel, like that, and have about 10 centimetres under there where there is no stretch. The foot should just remain in a relaxed position, and generally that'll be with it pointing down a little bit. Then we come up the calf, leave 5 centimetres on the paper, and we put about 50% stretch on the tape, and then just use the back of your hand initially down around the Achilles where it's a bit thinner. You sort of want to rub it in or stick it in. You'll probably get a little bit of a crease in it. That's not too much of a concern. And then the bit at the end just needs to be laid on, not pulled tight all the way to the top. So you've got 50% stretch through this bit here, and then nothing down the bottom. We then cut another piece of tape that's about 10 or 12 centimetres long. So we'll go about 12 and a half. And again, we just roll, I'll cut the corners off, like that. And then this one, we use the Band-Aid technique, which is basically tearing it in the middle, peeling the sides back, and then we generally go over the area of most tenderness or most soreness. So if this is the area where Lockie's feeling most of his pain, that's the area where we want to be taping. So we basically pull and put about 50% stretch over that area there, and then we lay it on with no stretch either side of it. All right, so the tape lifts the skin and it gives stability and support over the tendon in that area where the pain is.